Welcome, aspiring lifesavers. Whether you are sipping coffee on your study break or deep into exam preparation mode, you have just clicked on one of the most important NCLEX videos you will watch. We are diving into pharmacology of medication administration with 29 must-know questions that cover everything from intramuscular injections and intravenous safety to pediatric dosing, insulin timing, and narrow therapeutic index medications. Each question comes with clear explanations to help you master both the content and clinical reasoning behind it. We release new high-yield NCLEX videos every single day, covering the most critical topics you need to pass your exam. So make sure to watch till the end, follow us, and check back daily, because each video brings you closer to becoming a licensed registered nurse. Let's get started. Wait a moment before we continue. This could change your entire NCLEX prep. Our complete NCLEX review course includes 100 hours of animated lectures, 500 hours of deep dive teaching, 5,000 powerful practice questions, 500 NGN-style items, and 15 full-length exam simulations. You'll also receive a full-access NCLEX ebook for 12 months. The course is now 70% off, but not for long. Tap the link in the description and get started right now. All right, future nurses, let us dive into a foundational skill that shows up repeatedly on the NCLEX: correct injection techniques, especially when it comes to intradermal administration for tuberculosis screening. This type of question might seem simple at first, but understanding the correct angle, bevel direction, and injection depth is critical not just for getting the answer right, but for ensuring accurate patient care. Now let us look at question 1. A nurse is preparing to administer a purified protein derivative skin test to assess for latent tuberculosis infection. The medication will be delivered intradermally into the inner forearm using a 1 milliliter syringe with a 27-gauge short bevel needle. Which of the following actions demonstrates correct technique for this type of injection? Let us now review each of the possible actions and determine which one correctly reflects the intradermal injection technique. Here are your options. Option A. Retract the skin laterally and insert the needle at a 15-degree angle into the muscle. Option B. Position the needle with the bevel facing upward and insert it at a shallow 15-degree angle into the dermis. Option C. Insert the needle bevel up at a 45-degree angle to ensure adequate tissue absorption. Option D. Use a rapid dart-like motion to insert the needle bevel up at a 90-degree angle into the tissue. Take a moment to think about what you know regarding injection types, because understanding the subtle differences between intramuscular, subcutaneous, and intradermal techniques is key to answering questions like these. Now, let us go ahead and reveal the correct answer. The correct answer is Option B. Position the needle with the bevel facing upward and insert it at a shallow 15-degree angle into the dermis. Now, here is why this technique is the most accurate for administering a purified protein derivative skin test. When performing an intradermal injection, such as the one used to screen for tuberculosis, the goal is to introduce the fluid just beneath the surface of the skin, into the dermis, without going deeper. The bevel must face upward, and the needle should be inserted at a very shallow angle, typically between 5 to 15 degrees. This creates a small, raised wheal or bleb, which confirms correct placement. If you go too deep, the medication enters the subcutaneous tissue or muscle, which would invalidate the test. The other options describe incorrect techniques. Option A reflects a Z-track intramuscular method. Option C describes a subcutaneous approach used for medications like insulin, and Option D is typical of an intramuscular dart-like injection used for vaccines. Remember, in NCLEX-style questions, knowing your angles and anatomical layers can make all the difference. Let's keep going. More high-yield questions are coming your way. Let's keep the momentum going with another critical concept. Question number 2. Let us test your ability to recognize a critical safety error that could easily go unnoticed if you are not confident with injection techniques. Here is the question. While supervising a nursing student administering an intramuscular injection into the deltoid muscle of an adult client, which of the following observed actions by the student would require immediate correction? Let us go through the choices carefully and figure out which one indicates a serious error in technique. Here are your options. Option A. Depresses the syringe plunger simultaneously while inserting the needle into the muscle. Option B. Selects an injection site located midway between the olecranon process and the acromion. Option C. Uses the Z-track method when injecting into the deltoid muscle. Option D. Positions the client in a prone position with the arm rotated medially across the back. Think about what you already know about safe intramuscular injection practices, especially in terms of positioning, anatomical landmarks, and injection sequence. Now, let us take a look at the correct answer. The correct answer is option A, depresses the syringe plunger simultaneously while inserting the needle into the muscle. This action requires immediate correction because it violates one of the most basic principles of safe injection. The needle must first be fully inserted into the targeted muscle before any medication is delivered. Pressing the plunger as the needle enters the tissue increases the chance that medication will be deposited in the wrong layer, such as subcutaneous fat, which can reduce the medication's effectiveness and cause local tissue damage. It can also increase the risk of hitting a blood vessel or nerve. In contrast, option B shows a misunderstanding of injection site location. It describes a site closer to the vastus lateralis, or triceps region, rather than the mid-deltoid muscle, which should be located 2 to 3 finger widths below the acromion process. Option C is incorrect, because while the Z-track method is useful for deeper intramuscular sites like the ventrogluteal region, it is not needed for the small, superficial deltoid muscle. Lastly, option D involves an inappropriate client position. The prone position with the arm rotated medially is not standard for deltoid injections and makes the injection site difficult to access. For injections in the deltoid, the client should be sitting upright or lying supine with the arm relaxed. This question is a great reminder that clinical supervision is not just about observing. It is about catching mistakes early and reinforcing proper technique to protect the safety of patients and support the learning of future nurses. Here comes another high-priority scenario. Get ready for question number 3. Let us now shift our focus to a common home care scenario that the NCLEX loves to test: caregiver education for subcutaneous anticoagulant administration. Questions like these assess whether you can recognize teaching gaps that could result in serious complications. Let's jump into the question now. The nurse is providing home care instructions to a caregiver who will be administering enoxaparin injections to a client recovering from surgery. Which of the following statements made by the caregiver would require immediate follow-up? Let us walk through each statement carefully and identify which one signals the greatest risk to safe care. Here are your options. Option A, I will gently massage the area after giving the injection to reduce any discomfort. Option B, I should give this injection at a 30-degree angle. Option C, I will alternate the injection sites within the abdomen to prevent tissue damage. Option D, I will contact the healthcare provider if I notice any unusual bleeding or large bruises. Now, let us analyze the correct response based on safe medication practices and caregiver education. The correct answer is option B, I should give this injection at a 30-degree angle. This statement requires immediate follow-up because it demonstrates a fundamental misunderstanding of how to properly administer enoxaparin. Enoxaparin is given subcutaneously, and the appropriate injection angle is 90 degrees for clients with sufficient adipose tissue, or 45 degrees for those who are thin. A 30-degree angle is never used for subcutaneous injections, as it risks delivering the medication into the dermal layer rather than the subcutaneous tissue, which compromises absorption, increases bruising, and diminishes the medication's effectiveness. While option A is also incorrect, because massaging the injection site after giving enoxaparin can cause tissue trauma and bleeding. It is less critical than using the wrong injection angle. Option C is a correct statement because rotating abdominal injection sites reduces the risk of tissue damage and irritation. Similarly, option D reflects appropriate safety awareness, since monitoring for signs of bleeding or bruising is essential with any anticoagulant therapy. This question reinforces the importance of clear and thorough client education, especially when delegating medication administration responsibilities to caregivers at home. Ensuring safe technique is just as important as understanding side effects, and both must be addressed before discharge teaching is considered complete. Here comes another high-priority scenario. Get ready for question number 4. These kinds of questions test your ability to prioritize what protects the client most when powerful medications and devices are involved. Here is the question. A hospitalized client is receiving fentanyl via a patient-controlled analgesia device. After the client reports increasing pain, the healthcare provider prescribes new patient-controlled analgesia settings. The nurse programs the updated dose and lockout interval into the patient-controlled analgesia pump. Which action should the nurse take first to ensure client safety before restarting the infusion? Let us examine each of the options to determine which one should be performed first. Here are your choices. Option A, verify the new patient-controlled analgesia settings with another licensed nurse. Option B, record the changes in the medication administration record and progress notes. Option C, reassess the client's reported pain level and location. Option D, review the client's allergy history to confirm opioid tolerance. Think about your nursing priorities, especially when working with controlled substances and programmable infusion devices. Now, let us reveal the correct answer. The correct answer is Option A, verify the new patient-controlled analgesia settings with another licensed nurse. This is the first and most critical step to ensure client safety because fentanyl is a high-alert opioid medication, and any programming error in the dose or timing could result in severe respiratory depression or even death. Hospital policies require that 2 licensed nurses independently verify all patient-controlled analgesia settings, including the dose, lockout interval, and any continuous basal rate, before starting or restarting the infusion. This double check is a mandatory safeguard that directly prevents medication errors. Option B, while important, comes after safety is ensured. You should never document unverified changes, as that could reinforce an incorrect setting. Option C is not appropriate as the first step here because the client's pain was already assessed, which is what led to the new order. Your priority now is to verify the changes before initiating therapy. Option D would be relevant prior to the first dose of any opioid. But since the client is already receiving fentanyl, this does not take precedence. This question reinforces the importance of structured safety protocols and nursing accountability when handling high-risk medications, especially in technologically controlled systems like patient-controlled analgesia pumps. Let's roll into the next exam favorite, question number 5, which focuses on how to prevent serious bloodstream infections in clients with central lines. These types of questions require you to pinpoint the most effective single action that reduces risk. Let the question speak for itself. A nurse is caring for a hospitalized client with a central venous catheter inserted for long-term intravenous therapy. Which of the following nursing actions is most effective in preventing a central line-associated bloodstream infection? Let us go through the options to determine which nursing intervention plays the greatest role in infection prevention. Here are your choices. Option A, performing hand hygiene before and after every instance of accessing or handling the catheter. Option B, obtaining blood cultures from the central venous catheter at the end of every shift. Option C, applying sterile gauze dressings to the catheter site daily regardless of condition. Option D, flushing the catheter with heparin after each medication administration to maintain patency. Now, let us examine which action stands out as the top priority based on infection control principles. The correct answer is Option A, performing hand hygiene before and after every instance of accessing or handling the catheter. This is the single most effective and evidence-supported practice for preventing central line-associated bloodstream infections. Central venous catheters provide direct access to the bloodstream, so any contamination, no matter how minor, can lead to life-threatening infection. According to the Centers for Disease Control and Prevention, hand hygiene with soap and water or an alcohol-based hand rub must be performed every time a nurse touches or manipulates the catheter, whether it is during a dressing change, medication administration, flushing, or tubing connection. Option B is incorrect because routine blood cultures are not a preventative strategy and should only be ordered when infection is suspected. Drawing cultures unnecessarily can increase the risk of contamination and lead to false positive results. Option C is also incorrect. Daily dressing changes are not recommended unless the dressing is visibly soiled, damp, or loose. Transparent dressings can stay in place for 5 to 7 days, and frequent dressing changes may actually increase infection risk. Option D is a common misconception. While flushing with heparin or saline is necessary to maintain patency and prevent clot formation, it is not a primary strategy to prevent bloodstream infections. Not all lines require heparin, and it should only be used based on institutional policy. This question reinforces one of the core safety principles every nurse must follow. Consistent, rigorous hand hygiene is the first and most powerful defense against infection, especially when caring for clients with central lines. Let's pause for a second. Are you ready to take the NCLEX with confidence? If not, don't worry. The complete NCLEX review course has 100 animated hours, 500 recorded hours, 5,000 high-yield practice questions, 500 NGN cases, and 15 mock exams built to mirror the real test. You also get a 1-year ebook. Enroll now and get 70% off. Limited time offer. The link is right in the description. And now, another powerful question you cannot afford to miss. Question number 6. We are going to test your understanding of medication administration routes, an area the NCLEX often focuses on because incorrect technique can drastically reduce a drug's effectiveness. Many students confuse buccal with sublingual or oral routes, so knowing the differences is crucial. And just like that, here's your question. The nurse is preparing to administer a newly prescribed medication via the buccal route. Which of the following actions demonstrates correct technique for administering a buccal medication? Now, let us take a look at the options and determine which one reflects proper nursing practice. Here are your choices. Option A, places the tablet between the client's gum and inner cheek for absorption. Option B, inserts the medication under the client's tongue and instructs them not to swallow. Option C, mixes the medication in a small amount of water and has the client drink it slowly. Option D, applies the medication directly to the inner surface of the lower eyelid using sterile gloves. Think through each route carefully, especially how the medication is intended to be absorbed. Now, for the correct answer. The correct answer is Option A, places the tablet between the client's gum and inner cheek for absorption. This is the proper method for administering buccal medications. The tablet should be placed in the buccal mucosa, which is the space between the inner cheek and the gums, and it should dissolve slowly without being chewed or swallowed. This route allows the drug to be absorbed directly into the bloodstream through the oral mucosa, bypassing the liver's first-pass metabolism. Clients should not eat, drink, or chew gum during administration, and should be advised to alternate cheeks with subsequent doses to reduce irritation. Option B is incorrect because placing a medication under the tongue is considered sublingual administration, not buccal. Though both routes provide rapid absorption, they involve different anatomical sites. Option C is an oral route and should not be used for medications designed for buccal absorption, as swallowing them prematurely reduces their effectiveness. Option D refers to ophthalmic administration, which has nothing to do with buccal delivery and is entirely unrelated. This question emphasizes how critical it is for nurses to distinguish among similar-sounding routes to ensure that medications are administered safely and achieve their intended therapeutic effect. You're doing great. Let's challenge your thinking with question number 7 and turn to another fundamental NCLEX question that highlights one of the most essential principles in nursing practice, ensuring the right client receives the right medication. Even with everything else verified, skipping this step could lead to a critical error. Ready or not, here's the next question. A nurse is preparing to administer a prescribed medication to a hospitalized client. After verifying the correct medication, dose, route, and time, which of the following actions should the nurse perform next to ensure safe administration? Now, let us take a closer look at each option and identify which one must come next in the medication safety sequence. Here are your choices. Option A, confirm the client's identity using 2 approved identifiers such as full name and date of birth. Option B, review the client's current medication reconciliation form for potential drug interactions. Option C, assess the client's understanding of the medication regimen and ability to self-administer. Option D, notify the pharmacist of the administration time for potential therapeutic drug monitoring. Think about the 5 rights of medication administration and the exact point at which you are preparing to give the drug. Now, here is the correct answer. The correct answer is Option A, confirm the client's identity using 2 approved identifiers, such as full name and date of birth. This is a direct application of the 5th right, right client, and is absolutely essential before proceeding with medication administration. After confirming that the medication, dose, route, and time are correct, the next step is always to verify that you are giving it to the right person. 2 identifiers are required by safety standards and must be objective, such as checking the client's wristband and verbally verifying their name and date of birth. Option B, while part of broader medication safety, is typically addressed during admission, transfer, or discharge, not right before administration. Option C is a key part of patient education, but should be done either before the first dose is ever given or during discharge teaching, not as a substitute for confirming identity. Option D is sometimes relevant for specific drugs with therapeutic monitoring needs, but it is not universally required, and certainly not the next priority in the situation. This question serves as a strong reminder that confirming client identity is not just routine. It is a non-negotiable part of safe nursing care and a step that protects clients from one of the most preventable yet dangerous types of medication errors. Get your clinical judgment ready. It is time for question number 8. And this one dives straight into emergency pharmacology, where speed is everything. You are in the middle of a critical care situation, and the client is deteriorating fast. This is where your knowledge of medication routes could make all the difference. Let's fire up your brain. This is the question. A client in critical condition is experiencing hemodynamic instability and requires immediate pharmacologic intervention. To ensure the most rapid onset of action, which route of medication administration should the nurse expect to use? Now, let us examine each route and decide which delivers results when time is running out. Here are your choices. Option A, intravenous. Option B, rectal suppository. Option C, oral delayed release capsule. Option D, topical transdermal patch. Think about which of these gets the medication into the bloodstream instantly, without delays from absorption or digestion. The correct answer is option A, intravenous. This route delivers the drug directly into systemic circulation with no barriers in between. That immediate action is critical when treating conditions like shock, arrhythmias, or severe hypotension. It also allows for real-time adjustments to meet the client's changing needs. Option B is not fast or reliable enough for emergencies due to unpredictable absorption. Option C is even slower, requiring passage through the gastrointestinal tract, something that often does not work efficiently in unstable clients. And option D is the slowest of all, releasing medication gradually over several hours through the skin, making it completely ineffective in urgent scenarios. This question reinforces a cornerstone of emergency nursing. When every second matters, intravenous administration is the gold standard. Let's dive into another important question. Question number 9, which focuses on a nursing skill that seems simple but can have serious consequences if done incorrectly: applying topical nitroglycerin. These kinds of NCLEX questions are designed to test whether you understand not just the what, but the how behind medication administration. Now, take a look at this one. The nurse is preparing to administer a scheduled dose of topical nitroglycerin ointment to a client with chronic stable angina. Which action by the nurse reflects proper application technique? Now, let us walk through each of the options to determine which one aligns with safe and effective practice. Here are your choices. Option A, rotate the site of application with each dose to minimize skin irritation. Option B, apply the ointment over areas with visible veins to enhance vascular absorption. Option C, use clean tissue to spread a thin layer across a large surface of the client's back. Option D, apply the medication to moist skin immediately after the client showers for better adherence. As you consider these choices, focus on both drug absorption and patient safety. The correct answer is option A. Rotate the site of application with each dose to minimize skin irritation. This is a key nursing action to ensure consistent absorption while preventing local skin reactions and tolerance. The ointment should be applied to clean, dry, hairless skin, commonly on the upper arms, chest, or abdomen, and always using the manufacturer's applicator paper to measure and apply the correct dosage in a strip form. It should never be rubbed in or spread with bare hands or tissues. Option B is incorrect because visible veins are not required and may lead to inconsistent absorption. Option C introduces dosing errors and contamination risks by using an unapproved method of application. Option D is unsafe because moist skin interferes with both drug absorption and patch adherence. This question reinforces the critical details of medication technique, because even with the right drug, a wrong application can lead to poor outcomes. Here comes question number 10, an essential clinical scenario that every nurse must be ready to act on without hesitation. It is all about identifying a subtle but serious complication in intravenous therapy before it leads to real harm. All right, bring your focus. Here comes the question. A nurse is assessing a client receiving intravenous fluid therapy through a peripheral vascular access device. The client reports localized tenderness, and the nurse observes swelling and coolness at the infusion site. What is the most appropriate nursing action at this time? Let us now review each of the possible actions and decide which one is the safest and most appropriate clinical response. Here are your choices. Option A. Discontinue the infusion and take out the peripheral catheter. Option B. Flush the catheter with normal saline to assess for patency. Option C. Apply a tourniquet proximal to the intravenous site and notify the provider. Option D. continue the infusion at a slower rate and monitor the site closely. These symptoms are pointing toward a common intravenous therapy complication. So the question becomes, what should the nurse do first? The correct answer is option A, discontinue the infusion and take out the peripheral catheter. This is the most appropriate action because the signs described, localized tenderness, swelling, and coolness, are classic indicators of infiltration. Infiltration occurs when intravenous fluid leaks from the vein into the surrounding tissue, and continuing the infusion or flushing the catheter can worsen tissue damage. The immediate priority is to stop the infusion, remove the catheter, and elevate the affected limb to help reduce swelling. Option B is incorrect because flushing the catheter could force more fluid into the surrounding tissue, increasing the risk of damage. Option C involves applying a tourniquet, which is not indicated for non-vesicant fluid infiltration and is generally only considered in cases of extravasation with vesicant drugs, and even then, with specific provider guidance. Option D is dangerous because continuing to infuse into an infiltrated site can rapidly worsen swelling, discomfort, and complications like tissue necrosis or compartment syndrome. This question is a great example of how NCLEX tests your ability to act quickly on subtle signs, and reminds us that stopping harm is often the most important first step. Right before we get into the question, let me ask you this. Is your NCLEX prep complete? If not, the complete NCLEX review course gives you 100 hours of animations, 500 hours of lecture content, 5,000 high-yield questions, 500 NGN cases, and 15 mock exams, all with a year-long ebook. Save 70% today, but the deal won't last. Click the description link to enroll and start strong. Let's move to another high-yield question. Question number 11. And this one puts your IV skills to the test when it comes to central line maintenance. The NCLEX loves to ask about peripherally inserted central catheter care because improper flushing techniques can lead to serious complications like catheter occlusion or bloodstream infection. This one's important. Listen closely to the question. The nurse is caring for a hospitalized client with a peripherally inserted central catheter placed in the left basilic vein for long-term intravenous antibiotic therapy. Before initiating the next dose, the nurse prepares to flush the catheter to ensure patency and prevent occlusion. Which of the following actions by the nurse reflects evidence-based best practice for maintaining peripherally inserted central catheter line function? Let us now evaluate each flushing method to determine which one meets clinical safety and effectiveness standards. Here are your choices. Option A, using a 5 milliliter syringe to flush each lumen with 0.9% sodium chloride in a pulsatile manner. Option B, flushing each lumen slowly with 0.9% sodium chloride using a 10 milliliter syringe. Option C, using a 10 milliliter syringe to pulsatile flush each lumen with sterile water. Option D, flushing each lumen using a pulsatile technique with 0.9% sodium chloride in a 10 milliliter syringe. Now let us break it down. Technique, solution, and equipment all matter when maintaining central lines. The correct answer is option D, flushing each lumen using a pulsatile technique with 0.9% sodium chloride in a 10 milliliter syringe. This approach reflects gold standard practice supported by national guidelines. The 10 milliliter syringe is essential because its wider barrel produces lower pressure, reducing the risk of catheter damage. The push-pause or pulsatile method creates turbulence inside the line, helping clear fibrin or medication residue and preventing occlusion. Only 0.9% sodium chloride should be used, as it is isotonic and safe for vascular use. Option A uses the correct technique but the wrong syringe size. A 5 milliliter syringe creates too much pressure and could rupture the catheter. Option B uses the right size syringe and correct solution, but a slow continuous flush is not enough to clear debris from the catheter walls. Option C includes the proper technique and syringe size, but the use of sterile water is unsafe because it is hypotonic and can cause hemolysis. This question highlights the importance of knowing not just what to do, but exactly how to do it, to keep central lines safe, functional, and complication-free. All right, time to dive into the next must-know NCLEX topic. Question number 12, an important pharmacology concept that often shows up often: the timing of medications in relation to meals. Timing isn't just about when to give a medication. It can completely change how the drug works, how it is absorbed, or whether it even works at all. Now, let's see what you've got. Check out the question. A nurse is reviewing medication administration timing in relation to food intake following a continuing education program. Which of the following statements made by the nurse indicates an accurate understanding of how meal timing affects pharmacologic therapy? Let us now break down each of these timing strategies to see which one reflects correct nursing practice. Here are your choices. Option A, rapid-acting insulin should be administered approximately 5 to 10 minutes before meals. Option B, proton pump inhibitors should be taken immediately after eating to reduce heartburn. Option C, levodopa-carbidopa, should be administered with a glass of milk to reduce motor fluctuations. Option D, glucocorticoids are best absorbed on an empty stomach before the first meal of the day. Think about how timing affects the drug's effectiveness and safety. The correct answer is Option A. Rapid-acting insulin should be administered approximately 5 to 10 minutes before meals. This is because medications like insulin lispro, aspart, or glulisine have an onset of action within 10 to 15 minutes, and administering them just before a meal aligns insulin activity with the post-meal glucose spike. This helps prevent both hyperglycemia and hypoglycemia. Option B is incorrect because proton pump inhibitors like omeprazole or pantoprazole should actually be taken 30 to 60 minutes before meals, not after, since they work best when the proton pumps are most active, which is just before eating. Option C is incorrect because although milk may ease stomach irritation, the protein in milk competes with levodopa for absorption, reducing the drug's effect. Levodopa-carbidopa should ideally be taken on an empty stomach 30 to 60 minutes before meals. Option D is also incorrect because glucocorticoids can cause serious gastrointestinal irritation if taken on an empty stomach. These medications should be taken with food, and ideally in the morning, to mimic the body's natural cortisol cycle and reduce side effects. This question is a powerful reminder that even the best drug can fail or cause harm if the timing is wrong. As nurses, understanding this detail is key to ensuring medication safety and effectiveness. Let's move to another high-yield question. Question number 13, and this one zooms in on nasogastric tube safety. Especially when supervising new nurses, the NCLEX frequently tests your ability to recognize unsafe practices during enteral medication administration, and this scenario is packed with critical details that can protect your client from serious harm. Challenge time. Here comes the question. During morning rounds, the nurse observes a newly hired nurse preparing to administer oral medications via a Salem sump nasogastric tube for a client recovering from bowel surgery. The client has a double lumen tube in place for continuous, low, intermittent suction. Which of the following actions by the new nurse would require immediate intervention by the supervising nurse? Let us go through each of these steps to determine which one needs to be stopped immediately. Here are your choices. Option A. Irrigates the blue air vent with water to ensure both lumens are patent. Option B. Confirms tube placement by aspirating gastric contents before administering medications. Option C. Elevates the head of the bed to at least 30 degrees before initiating the procedure. Option D. Administers medications one at a time, flushing with water between each dose. One of these actions may seem helpful but is actually unsafe and puts the client at risk. The correct answer is Option A. Irrigates the blue air vent with water to ensure both lumens are patent. This is a critical error that requires immediate correction. The blue air vent on a Salem sump tube is not meant for flushing with fluids. Its purpose is to maintain continuous airflow and keep the gastric suction lumen from adhering to the stomach wall. Introducing water into the vent can block airflow, cause fluid to back up into the stomach, compromise suction, and even lead to aspiration or gastric injury. The vent should only be cleared with air if needed. Option B is correct practice, as aspirating gastric contents is a standard safety step to verify placement before administering anything into a nasogastric tube. Option C is also correct and essential. Elevating the head of the bed reduces the risk of aspiration and is required for all enteral medication procedures. Option D reflects safe, evidence-based practice for medication administration. Giving drugs one at a time and flushing with water between doses prevents drug interactions and helps avoid tube blockage. This question highlights the importance of understanding the anatomy and function of double lumen tubes like the Salem sump and reminds us that good supervision can prevent a small mistake from becoming a major complication. Let's dive into another important question. Question number 14. And this one focuses on a skill every pediatric nurse must master: reducing fear and trauma during injections. When caring for young children, it is not just about giving them medication, it is about how you give it. Emotional preparation, distraction, and therapeutic play can make all the difference in promoting cooperation and minimizing long-term fear of healthcare settings. And now, let's bring on the question. Another opportunity to score. Let's see the question. A nurse is preparing to administer a scheduled intramuscular injection of an antibiotic to a 4-year-old child who becomes visibly anxious and begins crying when seeing the syringe. To reduce procedural trauma and promote cooperation, which of the following nursing interventions is most appropriate? Now, let us explore each of the options to see which one reflects the best approach for a preschool-aged child. Here are your choices. Option A, draw a pretend magic circle on the injection site and invite the child to help create a smiley face afterward. Option B, request that the parent exit the room to avoid influencing the child's emotional response. Option C, give the child a small candy reward before the injection as a form of distraction. Option D, proceed quickly with the injection while minimizing verbal explanation to avoid escalating anxiety. When dealing with young children, combining creativity with compassion is often the key. The correct answer is Option A. Draw a pretend magic circle on the injection site and invite the child to help create a smiley face afterward. This technique uses therapeutic play, a developmentally appropriate strategy for preschoolers who respond well to imagination, visuals, and interactive involvement. It gives the child a sense of participation and control, reducing fear and encouraging cooperation. Adding a follow-up activity like drawing a smiley face helps to end the experience on a positive note. Option B is not appropriate because separating a child from their caregiver during a painful procedure can increase fear and distress. The presence of a supportive adult is generally beneficial unless it contributes to the child's anxiety. Option C, while well-intentioned, is not ideal. Giving candy beforehand is not a proven or safe method of distraction and may not address the root of the child's fear. Option D is incorrect because avoiding explanation does not reduce anxiety. Children benefit from brief, honest explanations in language they can understand. Rushing through without explanation may seem efficient, but it can undermine the child's sense of trust and increase future anxiety around medical settings. This question is a great reminder that pediatric nursing is as much about emotional intelligence as clinical skill, especially when it comes to building comfort and confidence in our youngest clients. Let's tackle another question that frequently shows up on the NCLEX, question number 15, and it highlights a clinical detail that absolutely must be correct. Needle selection for intradermal injections. When administering a purified protein derivative skin test for tuberculosis screening, precision matters. One simple error, like choosing the wrong needle size, can completely invalidate the results. You've got this. Now, let's take on the question. The nurse is supervising a nursing student who is administering a purified protein derivative intradermal skin test to screen for tuberculosis. Which action by the student would require the nurse to intervene? Let us walk through the options to determine which action is unsafe and needs immediate correction. Here are your choices. Option A selects a 20-gauge, 2-inch needle for the intradermal injection. Option B positions the client's forearm with the palm facing upward for the procedure. Option C cleans the injection site with an alcohol swab and allows it to dry before inserting the needle. Option D inserts the needle with the bevel up at a shallow 15-degree angle into the skin. When it comes to skill-based tasks like this, small details have a big impact on patient safety and diagnostic accuracy. The correct answer is Option A, selects a 20-gauge, 2-inch needle for the intradermal injection. This is a critical error that requires immediate intervention. A 20-gauge needle is far too large and long for intradermal use. It is typically used for intramuscular or intravenous administration. Purified protein derivative testing requires a 25 to 27 gauge needle that is short in length, usually between 3/8 to 5/8 of an inch, to ensure the medication is deposited precisely within the dermal layer. Using a larger needle increases the risk of injecting the solution subcutaneously, which can cause injury and result in an invalid test. Option B reflects correct positioning, as the client's forearm should be placed palm up, exposing the inner surface where the injection is administered. Option C is proper aseptic technique. Cleaning the skin and allowing it to dry prevents both irritation and interference with test results. Option D describes the exact technique required for intradermal administration, bevel up and a shallow 15-degree angle, which produces the characteristic wheal under the skin. This question reinforces the importance of technical accuracy in even the most routine procedures, and why supervision during clinical skills is so vital to safe, effective nursing practice. Before we break down this question, here's a game changer. The complete NCLEX Review online course gives you 100 hours of animation, 500 hours of recorded content, 5,000 essential questions, 500 NGN-style clinical cases, and 15 full mock exams. Plus, you'll get a detailed NCLEX ebook with 1-year access. Get in now. 70% off, but not for long. The link's in the description. Thousands of future nurses are already ahead. Don't get left behind. Let's move to another high-yield question. Question number 16. And this one walks you through the step-by-step process of initiating a peripheral intravenous line using evidence-based practice. This type of NCLEX question tests your ability to recall precise clinical sequencing, which is vital to prevent infection, ensure vein access, and promote patient safety. Here comes a brain twister. Can you solve it? The nurse is preparing to initiate a peripheral intravenous line in an adult client to administer prescribed fluids. Based on evidence-based practice guidelines, in what order should the nurse perform the following steps for safe and effective intravenous catheter insertion? Select the correct order of steps from first to last. Option A, apply a sterile dressing over the intravenous site. Option B, clean the selected site using 2% chlorhexidine and alcohol with friction for 30 seconds. Option C, place the tourniquet 10 to 15 centimeters above the proposed site. Option D, insert the intravenous catheter at a 15 to 30 degree angle. Option E, advance the catheter into the vein after confirming flashback while removing the needle. Option F, palpate the vein at the intended insertion site by pressing downward. Option G, reapply the tourniquet 10 to 15 centimeters above the anticipated site. Option H, release the tourniquet temporarily. Option Y, release the tourniquet and connect the luer lock end of extension tubing to the catheter hub. The correct order is Option C, Option F, Option H, Option B, Option G, Option D, Option E, Option I, and Option A. Option C comes first, as placing the tourniquet helps distend the vein for selection. Next is Option F, palpating the vein to confirm location and size. Option H follows, releasing the tourniquet to avoid venous stasis while preparing the site. Option B is the next step, cleaning the skin thoroughly with chlorhexidine and allowing it to dry. After that, Option G involves reapplying the tourniquet to re-engorge the vein. Then Option D is performed by inserting the catheter at the correct angle. Option E follows with advancing the catheter after flashback is seen and removing the needle. Option I is then completed by releasing the tourniquet and connecting the extension tubing. Finally, Option A is last, applying a sterile dressing over the intravenous site to maintain sterility and secure the line. This sequence ensures a safe, effective IV insertion and minimizes the risk of infection or complications. Ready for another core concept? Let's jump into question number 17. And it focuses on a high-alert medication that requires close attention before administration. Intravenous furosemide. When caring for a client with acute decompensated heart failure, safety checks before giving a rapid-acting diuretic can prevent life-threatening complications. Let's put your clinical brain to the test. Here's the question. A client admitted with acute decompensated heart failure is experiencing dyspnea and bilateral lower extremity edema. The healthcare provider prescribes intravenous furosemide to rapidly reduce fluid overload. As the nurse prepares to administer the first dose, which assessment must be completed prior to administration to ensure client safety? Let us examine the choices to identify the most appropriate priority assessment. Option A, review the client's most recent serum electrolyte panel for abnormalities. Option B, place the client in a high Fowler's position to improve pulmonary ventilation. Option C, confirm that the client has had a recent bowel movement. Option D, inform the client that increased thirst is a common side effect of the medication. The correct answer is Option A, review the client's most recent serum electrolyte panel for abnormalities. Furosemide is a loop diuretic known for its potent, rapid diuresis, especially when administered intravenously. However, it can quickly deplete key electrolytes such as potassium and sodium, leading to serious complications like arrhythmias or worsening heart failure. Before giving the first dose, The nurse must confirm that serum electrolytes are within safe limits, particularly potassium, to prevent potentially fatal adverse effects. Option B, although helpful for improving breathing, is a supportive nursing action and not the priority before giving a high-alert drug. Option C is unrelated, as bowel movement history has no impact on the safety of administering furosemide. Option D involves client teaching, which is valuable but does not take precedence over assessing lab values when client safety is at stake. This question reinforces the need for critical thinking when administering medications that can affect fluid balance, cardiac rhythm, and renal function, especially in clients already at risk for complications. Here's another scenario that might look familiar on exam day. Question number 18, and this one focuses on medication safety with ophthalmic drug administration, a common area where students often make simple but serious mistakes. Supervision during eye drop administration is critical, not just to ensure therapeutic effect, but also to avoid corneal injury or contamination. All right, bring your focus. Here comes the question. A nurse is supervising a nursing student who is preparing to administer ciprofloxacin ophthalmic drops to a client with bacterial conjunctivitis. Which student action demonstrates correct technique during the administration? Let us go through each of the options to identify the one that reflects proper clinical practice. Option A instills the prescribed number of drops into the lower conjunctival sac without touching the applicator to the eye. Option B applies pressure to the upper eyelid immediately after administering the drops to aid in distribution. Option C positions the client in a prone position and tilts the head to the side for better drainage. Option D administers the eye drops directly onto the corneal surface while instructing the client to blink rapidly. The correct answer is Option A. Instills the prescribed number of drops into the lower conjunctival sac without touching the applicator to the eye. This technique ensures the medication is properly absorbed while protecting the eye from trauma and the dropper from contamination. The lower conjunctival sac is the safest and most effective location for drop administration, and avoiding contact with the applicator maintains sterility. Option B is incorrect because pressing on the upper eyelid offers no clinical benefit and may cause discomfort. Option C is not appropriate. The client should be in a supine or seated position with the head tilted back, not prone or side-lying. Option D is unsafe because placing drops directly on the cornea can cause pain and blinking that reduces drug retention. This question reinforces the need for attention to detail and adherence to evidence-based techniques, especially when performing delicate procedures like ophthalmic administration. Let's keep going with another confidence-building question. Question number 19. And this one highlights a common but critical medication teaching moment: proper home administration of enoxaparin. When caregivers are involved in subcutaneous injections, even small misunderstandings, like what to do with an air bubble, can compromise safety and therapeutic effect. And we are live with the question. The nurse is educating the caregiver of a client who has been discharged on enoxaparin therapy following total knee arthroplasty. The caregiver will be administering the injections at home using a pre-filled syringe. Which statement by the caregiver would indicate a need for immediate follow-up? Let us now review the options to determine which response signals a safety risk. Option A, I will rotate the injection sites in the lower abdomen to avoid skin irritation. Option B, I need to push out the air bubble from the syringe before giving the injection. Option C, I'll avoid massaging the injection site afterward to prevent bruising. Option D, I will watch for signs of unusual bleeding like nosebleeds or blood in the stool. The correct answer is Option B. I need to push out the air bubble from the syringe before giving the injection. This statement reflects a serious error in administration technique. Enoxaparin is packaged in a pre-filled syringe that includes a small air bubble, which should not be expelled. That air bubble functions as an airlock, ensuring the full medication dose is delivered deep into the subcutaneous tissue and helping prevent tracking of the drug, which can lead to bruising and irritation. Expelling the bubble before injection not only alters the dose, but also interferes with proper absorption and increases the risk of complications. Option A is correct practice. Rotating abdominal injection sites helps minimize skin irritation and lipodystrophy. Option C is also correct, as massaging the injection site is contraindicated and could worsen bruising due to the anticoagulant effect. Option D demonstrates appropriate awareness of bleeding risks associated with anticoagulant therapy, which is a critical part of safe home care. This question reinforces how essential proper discharge teaching is, especially when caregivers are tasked with administering high-risk medications like enoxaparin at home. Time to level up again. Here comes question number 20, and it focuses on a foundational concept every nurse must master: understanding the difference between intravenous therapy complications like infiltration, extravasation, and infection. When nursing students confuse these terms, it can lead to delays in treatment or improper care, so clear definitions are essential. Let's fire up your brain. This is the question. During a clinical skills seminar on intravenous therapy complications, a nursing instructor asked students to define the term infiltration. Which student response would the nurse recognize as correct? Let us break down the choices to determine which one matches the true clinical definition. Option A: infiltration occurs when a non-vesicant intravenous fluid inadvertently enters the surrounding subcutaneous tissue. Option B: infiltration refers to inflammation at the catheter insertion site due to microbial contamination. Option C: infiltration is the entry of a vesicant medication into the venous circulation, increasing systemic toxicity risk. Option D: infiltration occurs when air enters the venous system and travels to the lungs, leading to respiratory distress. The correct answer is option A. Infiltration occurs when a non-vesicant intravenous fluid, such as normal saline or dextrose, escapes from the vein and leaks into the surrounding subcutaneous tissue. This can result from catheter dislodgement or vein trauma and presents as swelling, coolness, tenderness, and a slowed or stopped infusion. Although infiltration is generally less dangerous than extravasation, it still requires prompt nursing intervention, including stopping the infusion, removing the catheter, and elevating the affected limb. Option B is incorrect because it describes phlebitis or infection, not infiltration. Phlebitis involves redness, warmth, pain, and possibly systemic symptoms due to microbial contamination. Option C misrepresents infiltration by referencing vesicants and systemic toxicity, which actually describes extravasation, where vesicants leak into tissues, causing severe local damage, not systemic effects. Option D is inaccurate because it defines a venous air embolism, a completely different and far more serious complication involving air in the vascular system. This question reinforces the importance of understanding intravenous therapy complications and using the correct terminology to drive safe and effective interventions. Hold on just a sec. Let's talk strategy. The complete NCLEX Review online course is your fast-track prep kit. 100 animated hours, 500 hours of lectures, 5,000 questions, 500 NGN-style cases, and 15 exam simulations. All this plus a year-long NCLEX EBOOK. Act fast. It's now 70% off for a limited time. Visit our site using the link in the description and start today. Another NCLEX hotspot coming your way. Question number 21. And this one focuses on anatomical precision when selecting an intramuscular injection site. Administering an injection in the wrong location can cause serious complications, so knowing exactly how to landmark muscles, like the vastus lateralis, is a must for safe nursing practice. Now, take a look at this one. The nurse is preparing to administer a prescribed intramuscular injection of ceftriaxone to an adult client using the vastus lateralis site. Which of the following demonstrates correct identification of the anatomical landmark for this injection site? Let us evaluate the options to determine which method reflects evidence-based technique. Option A palpates the greater trochanter and lateral femoral condyle, divides the length between them into thirds, and selects the middle third of the anterolateral thigh for injection. Option B identifies the posterior superior iliac spine and injects into the upper medial quadrant of the gluteal region. Option C locates the inferior border of the scapula and inserts the needle into the lower half of the deltoid muscle. Option D measures 1 inch above the patella and injects directly into the anterior surface of the thigh muscle. The correct answer is option A. Palpates the greater trochanter and lateral femoral condyle, divides the length between them into thirds, and selects the middle third of the anterolateral thigh for injection. This method accurately locates the vastus lateralis muscle, which is located on the lateral aspect of the thigh. It is well developed, easily accessible, and considered one of the safest sites for intramuscular injections, especially because it avoids major nerves and vessels. Option B is incorrect because it refers to the dorsogluteal site, which is outdated and carries a high risk of sciatic nerve injury. Option C is also incorrect, as it misrepresents the deltoid landmark and involves the scapula, which is not used to identify the deltoid site. Option D is not appropriate either, because injecting 1 inch above the patella risks targeting tissue too close to the knee joint and anterior structures, increasing the chance of pain, ineffective delivery, or injury. This question reinforces the importance of using clear anatomical landmarks for safe, effective medication administration, especially when selecting large muscle groups like the vastus lateralis. Stay focused. Here's your next high-yield checkpoint, question number 22, and this one highlights a safety concern that every nurse must be alert to: outdated intramuscular injection practices. When supervising new nurses, it is critical to catch errors in site selection before they lead to complications like nerve damage or poor medication absorption. Here comes the question. While supervising a newly hired nurse, during the administration of an intramuscular injection to an adult client, the precepting nurse observes the following actions. Which action by the new nurse requires immediate correction? Let us evaluate each action to determine which one presents the most urgent safety concern. Option A selects the dorsogluteal site as the intended location for the intramuscular injection. Option B inserts the needle at a 90-degree angle into the selected muscle site using a smooth, steady motion. Option C identifies the ventrogluteal site by placing the heel of the hand on the greater trochanter and spreading the index and middle fingers to form a V. Option D applies gentle pressure with gauze after withdrawing the needle from the muscle. The correct answer is Option A, selects the dorsogluteal site as the intended location for the intramuscular injection. This action requires immediate correction because the dorsogluteal site is no longer recommended due to the high risk of sciatic nerve injury and the proximity of major blood vessels. Despite being used in the past, current best practices strongly favor safer sites such as the ventrogluteal, vastus lateralis, and deltoid muscles. Continuing to use the dorsogluteal site reflects outdated knowledge and increases the risk of complications. Option B is correct technique, as inserting the needle at a 90-degree angle ensures the medication is delivered deep into the muscle for proper absorption. Option C also reflects safe practice. The ventrogluteal site is identified using anatomical landmarks, and it is a preferred site due to its distance from nerves and vessels. Option D is appropriate as well. Applying gentle pressure helps control bleeding without risking tissue damage or increasing discomfort. This question reinforces how essential it is for supervising nurses to intervene when outdated or unsafe techniques are observed. Because best practice is not just about knowing what to do, but also knowing what to stop doing. Let's see if you can apply what you've learned. Question number 23. And this one focuses on the correct administration of otic medications in pediatric clients. When treating ear infections in children, using the proper technique is essential to ensure the medication reaches the site of infection effectively and comfortably. Here it is. The nurse is preparing to administer a prescribed otic solution to a 6-year-old child diagnosed with otitis externa. Which of the following actions indicates that the nurse understands the proper technique for administering eardrops to this pediatric client? Let us go through each of the options to identify the one that demonstrates safe and age-appropriate practice. Option A gently pulls the auricle upward and outward before instilling the medication into the ear canal. Option B positions the child in a prone position with the affected ear turned downward against the mattress. Option C inserts the prescribed eardrops directly onto the tympanic membrane to ensure maximum absorption. Option D administers cold ear drops directly from the refrigerator to preserve potency. The correct answer is Option A, gently pulls the auricle upward and outward before instilling the medication into the ear canal. This is the correct technique for administering eardrops to children older than 3 years of age. Pulling the ear in this direction straightens the ear canal, allowing the medication to flow properly toward the tympanic membrane without causing pain or injury. The child should also be lying on their side with the affected ear facing upward to allow gravity to assist in delivery and absorption. Option B is incorrect because having the affected ear facing downward may cause the medication to leak out before it has a chance to work. Option C is inaccurate and unsafe, as the drops should never be applied directly to the tympanic membrane. Doing so risks discomfort and injury. Option D is also incorrect, as administering cold eardrops can cause vertigo and distress. Eardrops should always be warm to room temperature to improve comfort and tolerance. This question reinforces the importance of age-specific techniques and proper positioning during OTC medication administration in children. Another chance to show what you know. Here comes question number 24. And this one targets a core nursing responsibility that directly impacts patient safety: medication reconciliation. Ensuring accuracy in a client's medication list during transitions of care is one of the most effective ways to prevent errors, adverse drug events, and complications. Let's bring on the question. The nurse is leading an interprofessional staff development session focused on reducing medication-related errors through medication reconciliation. Which statement reflects accurate understanding of when and how this process should be performed? Let us examine each option to determine which one aligns with best practices. Option A, medication reconciliation must be completed at the time of hospital admission, during transfers between units or settings, and again at discharge. Option B, medication reconciliation is the responsibility of the pharmacist and does not require nursing involvement. Option C, this process should focus on verifying only the prescribed medications listed in the client's chart. Option D, medication reconciliation is optional if the client reports no recent changes to their prescriptions. The correct answer is option A. Medication reconciliation must be completed at the time of hospital admission, during transfers between units or settings, and again at discharge. These transitions are the highest risk moments for medication discrepancies, omissions, or duplications to occur. Nurses play a vital role by gathering a complete and accurate medication history, including prescribed medications, over-the-counter drugs, supplements, and herbal products. This information is verified with the client and shared across the care team to ensure consistency and safety. Option B is incorrect because medication reconciliation is a team-based responsibility. While pharmacists provide expertise on interactions and dosing, nurses are responsible for frontline medication verification and client education. Option C reflects a dangerous misconception, as focusing only on the prescribed medications listed in the chart may overlook unrecorded or self-administered drugs, which could lead to harmful interactions. Option D is also unsafe. Just because a client reports no changes does not mean discrepancies are not present. Clients may forget to mention certain drugs, stop taking medications without documentation, or be using unreported substances. This question emphasizes that effective medication reconciliation requires diligence, clinical communication, and full collaboration between nursing, pharmacy, and medical teams to protect clients across every transition of care. Let's move into another real-world clinical scenario. Question number 25. And this one highlights a major safety issue in geriatric care: managing medications in older adults. When developing wellness programs for aging populations, nurses must focus on high-impact interventions that can reduce hospitalizations, injuries, and mortality. And medication safety is at the top of that list. Here's the next question. The nurse is developing a community-based wellness class for older adults focused on health maintenance and injury prevention. Which topic should the nurse prioritize to reduce adverse outcomes in this population? Let us examine each option to identify the most effective and urgent priority. Option A, educating participants about the risks of polypharmacy and how to manage multiple medications safely. Option B, promoting routine stretching exercises to enhance joint flexibility and comfort. Option C, encouraging older adults to attend monthly social gatherings to reduce loneliness. Option D, reviewing recommendations for routine dental screenings and oral care in aging populations. The correct answer is Option A, educating participants about the risks of polypharmacy and how to manage multiple medications safely. Polypharmacy is one of the leading contributors to adverse drug reactions, falls, confusion, and preventable hospital admissions among older adults. Many clients take 5 or more medications daily, increasing the chance of harmful interactions and side effects, especially with drugs that have anticholinergic or sedative properties. Prioritizing education on this topic empowers older adults to actively engage in medication reconciliation, ask questions about side effects, and work with healthcare providers to minimize unnecessary prescriptions. Option B is beneficial for mobility and flexibility, but it does not directly address the most immediate health threats in this population. Option C supports emotional and social health, but from a clinical safety standpoint, preventing medication-related harm carries a higher urgency. Option D is also valuable for long-term health maintenance, but it ranks lower when compared to the life-threatening consequences of polypharmacy. This question reinforces the role of nurses in identifying the most impactful education topics and tailoring wellness programs to prevent serious outcomes and maintain independence for older adults in the community. One quick heads up before we begin. If you're serious about passing the NCLEX, the complete NCLEX Review online course has every resource you need. 100 animated hours, 500 in-depth lectures, 5,000 questions, 500 NGN items, and 15 simulated exams. You'll also get a 1-year NCLEX ebook to study anytime. Right now, get 70% off, limited time offer. Click the link below and take your first step toward passing. Think like a nurse, act like a nurse. Let's tackle question number 26. And this one emphasizes the critical role nurses play in administering high-risk medications, those with a narrow therapeutic index. These drugs demand accuracy and consistency, because even slight deviations can lead to toxicity or therapeutic failure. Let's see how you do on this one. Here comes the question. A nurse is caring for a hospitalized client who is prescribed a medication known to have a narrow therapeutic index. Which action by the nurse is most appropriate to ensure safe and effective medication administration? Let us evaluate each response to determine which one reflects the safest nursing practice. Option A. Administer the medication exactly as ordered, adhering strictly to the prescribed dose, route, and timing. Option B. Recommend the client take the medication with an energy supplement to boost absorption. Option C. Adjust the medication schedule slightly to align with the client's preferred daily routine. Option D. Administer the medication with a full meal, regardless of its interaction profile, to minimize gastrointestinal upset. The correct answer is Option A. Administer the medication exactly as ordered, adhering strictly to the prescribed dose, route, and timing. Medications with a narrow therapeutic index, such as warfarin, digoxin, phenytoin, and lithium, have a very small window between therapeutic and toxic blood levels. Because of this, nurses must administer them with exact precision, ensuring that the dose, route, and timing are consistent and not altered. Option B is unsafe, as supplements may interfere with drug metabolism or absorption, and recommending them without provider approval is inappropriate. Option C reflects a well-meaning attempt at individualized care, but changing the timing of an NTI drug without a provider's order can be dangerous. Option D may increase comfort, but administering the drug with food without evaluating its specific interaction profile can reduce absorption or increase risk. This question underscores how essential it is for nurses to understand the pharmacokinetics and safety requirements of NTI drugs, and to advocate for strict adherence to protocols in order to protect the client. We're getting closer to mastery. Next is question number 27, and this one focuses on neonatal care and the precise technique needed for safe intramuscular injection right after birth. Administering medications like vitamin K to newborns requires careful consideration of anatomical differences and equipment sizing to avoid injury. Now, take a look at this one. The nurse is preparing to administer a prescribed intramuscular injection of vitamin K to a full-term neonate shortly after birth. Which needle gauge and length is most appropriate to use for this procedure? Let us review each option to determine which one aligns with neonatal safety standards. Option A, 22-gauge 1-inch needle. Option B, 21-gauge 1 1/2-inch needle. Option C, 23-gauge 1-inch needle. Option D, 25-gauge 5/8-inch needle. The correct answer is Option D, 25-gauge 5/8-inch needle. This size is ideal for neonatal intramuscular injections because it provides the correct depth to reach the muscle without risking injury to deeper structures. The smaller 25-gauge diameter reduces tissue trauma, and the 5/8-inch length is sufficient to access the vastus lateralis muscle, which is the preferred site for neonates. This site is well developed at birth, free from major nerves and blood vessels, and accessible for proper positioning. Option A is incorrect because the needle is too long and has a wider diameter, increasing the risk of pain and trauma. Option B is even less appropriate, as a 1 1/2-inch 21-gauge needle is designed for deep intramuscular injections in adults, not neonates, and may cause significant tissue damage. Option C is smaller in gauge but still too long for neonatal muscle mass. A 1-inch needle can go too deep in a newborn, leading to complications. This question reinforces that in neonatal care, even the smallest technical details, like choosing the right needle, can have a major impact on safety, comfort, and clinical effectiveness. And just when you thought it was easy, here comes question number 28. And this one highlights the importance of rapid clinical judgment when managing intravenous complications. Infiltration is a common but potentially harmful event, and how the nurse responds in those first moments can determine whether the client experiences minor discomfort or lasting tissue damage. You've got this. Now let's take on the question. The nurse is caring for a hospitalized client who is receiving a continuous infusion of isotonic intravenous fluids through a peripheral catheter. During routine assessment, the nurse notes swelling, pallor, and coolness at the insertion site, along with the client reporting a tingling sensation. What is the most appropriate initial nursing action? Let us break down the options and identify which one ensures safety and immediate correction. Option A, immediately stop the infusion and remove the intravenous catheter from the affected extremity. Option B, reduce the infusion rate and observe the site for any worsening symptoms over the next hour. Option C, attempt to reposition the catheter within the vein and flush the line with a small amount of saline. Option D, elevate the extremity and apply a warm compress while the infusion continues at a slower rate. The correct answer is Option A. Immediately stop the infusion and remove the intravenous catheter from the affected extremity. These signs, swelling, pallor, coolness, and tingling, are classic indicators of infiltration, meaning the fluid is no longer entering the vein and is instead leaking into the surrounding tissue. The absolute priority is to stop the infusion immediately and remove the catheter to prevent further tissue compromise. Supportive measures like limb elevation and warm compresses may follow, but only after the source of infiltration has been eliminated. Option B is incorrect, because continuing the infusion, even at a slower rate, can worsen tissue swelling and lead to complications. Option C is unsafe, as attempting to reposition or flush a compromised catheter may force more fluid into the tissues and should never be attempted when infiltration is suspected. Option D also delays the critical first step, discontinuing the infusion, and instead incorrectly focuses on comfort while allowing the infiltration to continue. This question reinforces that timely action is everything when complications arise, and nurses must trust their assessments, act quickly, and know when to escalate care. This next one could make or break your test. Get ready for question number 29, and this one emphasizes the critical thinking and rapid action needed in emergency care scenarios. When a client presents in hypovolemic shock, the priority is to restore circulating volume quickly and efficiently, and that begins with choosing the right intravenous access. Let's jump into the question now. A client is brought to the emergency department with signs of hypovolemic shock following a motor vehicle collision. The healthcare provider prescribes the immediate administration of a large volume of isotonic intravenous fluids. To ensure rapid and effective volume resuscitation, which gauge catheter should the nurse select for peripheral vascular access? Let us review the options to determine the most appropriate catheter for this urgent situation. Option A, 18-gauge catheter. Option B, 23-gauge catheter. Option C, 25-gauge catheter. Option D, 22-gauge catheter. The correct answer is Option A, 18-gauge catheter. This size is considered a large-bore peripheral intravenous line and is the gold standard for administering large volumes of intravenous fluids and blood products rapidly. In shock and trauma, the priority is speed and volume, and an 18-gauge catheter allows for high flow rates with minimal resistance. When feasible, placing two large-bore catheters provides redundancy and maximizes fluid delivery. Option B is too small to support the necessary infusion rate in emergencies and may occlude or delay resuscitation efforts. Option C is typically used in neonates or elderly clients with fragile veins and is entirely unsuitable for high-volume infusion. Option D, while acceptable for routine hydration or slow infusions, does not offer the flow rate needed in cases of hypovolemic shock. This question reinforces a fundamental emergency nursing principle: large gauge, large vein, and rapid access save lives in shock management. Selecting the correct catheter size is one of the fastest and most impactful decisions a nurse can make in a crisis. And that wraps up today's power-packed NCLEX prep session on pharmacology of medication administration. We just covered 29 essential questions, each one packed with real-world scenarios, clinical insight, and detailed explanations to strengthen your understanding of safe and effective medication practices. From injection techniques and intravenous complications to narrow therapeutic index medications and pediatric safety, you now have a solid grasp of the kind of critical thinking the NCLEX expects from every future nurse. But this is just one piece of your journey. We bring you new high-yield NCLEX content every single day, covering the most tested and most important topics to help you pass the exam with confidence. So, if you found this helpful, don't stop here. Watch our videos regularly, follow us, and stay plugged in, because tomorrow, we are back with another must-know topic that could be the difference between almost passing and truly crushing the NCLEX. Keep showing up, keep learning, and let us help you get one step closer to becoming a licensed registered nurse. We'll see you in the next video.